Good evening. I am Thesor Cheatham, and today I'm going to be talking about the elderly population as being a vulnerable group. Elderly. The term elderly can be defined in many ways. For the purpose of this presentation, the term will encompass those individuals who are 65 years of age or greater. The elderly in the U.S. are considered to be a vulnerable population in regards to health and wellness and provision of health care. In Alabama, the growth of and problems of the elderly has been identified as the 10th greatest current health concern in the state. Alabama's elderly population is expected to grow by 82.4% between 2010 and 2040, adding 542,061 elderly to the population. Are the elderly a vulnerable population? The elderly in America are considered to be a vulnerable population in regards to health and wellness and provision of health care. While this consideration may sometimes be based on assumptions related to age and wellness or lack thereof, there are increased risk factors that do place a majority of this population at a higher risk for illness and injury. There are also false images correlated to age, poor health, and thoughts of decreased satisfaction of life. However, in order to change that view of health of the elderly, it is important to recognize which aspects are actual risks and provide health care and education in order to confront and manage those risks, and to provide the highest quality of living possible for this ever-increasing population. The elderly have often been viewed as being frail just because they are elderly. This is a common thought and one I have been exposed to as well as probably thought myself. I have made assumptions that a patient's quality of life was lacking simply based on the patient's age. When I have seen a surgeon contemplating a procedure on a 90-year-old, I have said to myself, what's the point? There is often a common thought that there is a complete lack of health and well-being once one reaches a certain age. The idea of living well, stamina, and good health often go hand in hand when people describe youth. Often, elderly patients are not offered the same treatments or options as their younger counterparts are. There is sometimes a thought that if a patient is over a certain age, they have lived their lives and should just die and not continue to try to find treatments for any ailments or illnesses they may have. There is a general non-appreciation for the elderly of the United States. We are a country that does not take very good care of our elderly, often disregarding their health care and placing an increased number of them in nursing homes. There are risk factors that come along with age. However, that can affect one's health, including decreased mobility, increased incidence of chronic disease, possible social isolation, financial decline related to voluntary or involuntary retirement, nutritional needs, and a host of age-related changes and illnesses that affect this group. They may have significant emotional losses such as that of a spouse or home, or other drastic changes that affect and change their previous lives and views of self. The elderly are more likely to suffer from falls, burns, car accidents, social isolation, abuse, and more likely to fall victim to numerous diseases. There are also a lack of resources available to the elderly to help them manage or deal with these issues. While these risk factors can have a drastic effect on one's quality of life, many of them can be managed and or prevented. The key to providing optimum care to this group is recognizing the actual risk factors and tailoring healthcare and education towards the elderly patient. It is therefore important to recognize these risks and address them while also acknowledging any biases. After researching the different risks and challenges the elderly face, I realized there is an important and urgent need to provide health care as well as education and resources for this population. It is also apparent that quality of life is a very complex idea and is not based solely on the number of years one has lived. An individual should retain rights, dignity, and respect regardless of his or her age. Just because a patient is 89 years old does not mean they are not a candidate for surgery or treatment, just as the same should be said for a patient of any age. For instance, a 22-year-old may not be a candidate for a kidney transplant, but this is decided based on many factors other than age. While it is realistic to take into account a patient's age when deciding on the treatment and care plan, it is not and should not be the only determining factor. There is an important and urgent need to provide health care, education, and resources for this vulnerable population. This population needs to be provided the best education possible from healthcare providers while also identifying resources that are available to assist with the patient's life outside of the healthcare facility. A patient is more likely to return to the previous level of functioning if thorough and complete education has been provided. This idea and practice is one that should be taught and encouraged to all healthcare providers. The nurse must advocate for appropriate and quality care for his or her patients, while providers, nurses, social workers, and assistive personnel have this goal in mind. It will be reflected in the overall health of the population. There are a number of problems with this population that social workers might help with. Some of these problems may include, but are certainly not limited to, financial problems such as living on a fixed income or finding employment, medical problems such as finding adequate care or applying for medical benefits, and mental health issues such as depression or grief. Social issues such as loneliness or finding social activities. The state of Alabama has community resources for the elderly, such as companionship programs, Alabama Lifespan Respite Resource Network, Alabama Cares, Birmingham Jefferson County Transportation Authority, and paratransit and VIP services. Many of Alabama's counties offer companionship programs to seniors within the community. For example, Mobile, Alabama offers a foster grandparent program, a senior volunteer program, and a typical companion service to community members. Each county's programs may differ, and each program's services may vary. Seniors who want to know more about their community's companionship program should contact their local area agency on aging for more information. Alabama Lifespan Respite Resource Network offers free caregiving courses, informational articles, and referrals to all other services when necessary. Caregivers can also access voucher respite services through the ALRRN to make temporary care more affordable. Alabama Cares is a type of family and caregiver support program. This program works in conjunction with the National FCSP. Qualifying caregivers can receive temporary respite care, training, counseling, and supplemental services through Alabama Cares, all free of charge. Birmingham Jefferson County Transportation Authority offers discounted tickets to riders with a Medicare card and riders over the age of 62. The ticket prices are significantly reduced and can cost as low as 60 cents for a single ride. Paratransit and VIP services through the BJCTA sponsors the paratransit and VIP service to accommodate mobility impaired riders. Riders do not have to wait at a bus stop to catch their ride, allow them to travel with a peace of mind. Here are my references. Thank you.